Hey y'all. So like I was saying in my last video, I did have a spinal corrective surgery, and then I also had a breast reduction. I had a breast reduction 2 years ago. And like I said, due to me having scoliosis, that's the reason why I ended up having a breast reduction. I never got top heavy until I got in my 30s. So most people, they get top heavy, like I said, once they hit puberty and all of that. No, I was a late bloomer, baby. I was a late bloomer in this area. And so, like many people, they run to, YouTube, TikTok, Twitter, Facebook, and they want to, understand the severity of having a breast reduction. And see, me, I'm very transparent. If I got the knowledge, I'm going to tell you the knowledge. So like I said, me having a breast reduction, literally 2 years ago, it was the best decision I ever made. Only reason why I did have a breast reduction is because of my back. Like I said, I had scoliosis. I do have rods in my back. My breasts were very heavy. I was a triple D 38. And what I was noticing, I was getting like this extra, like little on the side. And it was just from fat gain, as far as that, but that's considered as breast tissue too. So I procrastinated about it for so long. I actually thought that I was one person that would never in a million years have to get it. Like so many of my family members have had it, even my mom has had a breast reduction, and I was just scared, and the severity, the fact that you're having a breast reduction, it's your breast. And nothing is wrong with your breast. That's the whole thing. People have these surgeries and nothing is wrong, or they want to enhance the breast and stuff like that. Me personally, I never wanted breasts. I can remember being in middle school and I hated the fact that I had boobs. So like with me, what I did, I actually didn't have to pay for anything. Now I did pay for a lift to lift my breast up. Because what it was, I had gained weight and I didn't want my breast to just be, just the tissue to just be stuffed in. So what I did was I did get a lift. I mean, I had to technically. So basically what I did was I went to Vanderbilt, what did I go to? Vanderbilt Cosmetic Surgery Center. That's why I went. It's in Franklin, Tennessee. I went there. I seen Dr. Kent Higdon. That's who my surgeon was. Best bad manners. God, that man got great bad manners. If you ever want a plastic surgeon, go to that man. He is great. Hands down, he take initiative to his patients. Me personally, he did great with me. No complaints. A1. Perfect. Everything perfect. Scarring, everything perfect. But what he did was he really got into the nitty gritty of my case. He basically just told me like, yes, we finna cut out this much on your sides, both sides. We gonna lift them up. We gonna do this. We gonna do that. You gonna be good as new. And, so what I did was at the time I had, Blue Cross Blue Shield insurance. And, that's the biggest thing is people get these surgeries and stuff like that. And they're like, oh, well, my medical insurance will cover for it. See, mine was a medical reason of me getting a breast reduction. So most people, they don't know, but when you get a breast reduction, you have these things called dents right here. So as you can see, I have scoliosis. I will forever have these dents. If you see how big my shoulder is, I had a dent that looked like a heel. It literally looked like a heel from my shoulder to my arm. It looked like it was way bigger than it. Instead of, most people, they have it straight where everything is balanced. Not me. So based upon my photos that they took, they submitted it to my insurance company. My insurance company approved it immediately. I went on December the 30th. Literally, they approved it. I promise you, probably by January the 5th. I procrastinated and waited because first and foremost, like I said, he's a great plastic surgeon. I had to wait all the way to April for this man to initiate my procedure. And I had it on April the 21st of 2021 is when I had it. So based upon me having this surgery, of course, the general, You know, they tell you, you know, you do your pre-op, they tell you get your medical scrub, you know, make sure you scrub, have, you know, your nails clear, all your jewelry, makeup, everything off. If this is something you've never experienced, a surgery, these are things that you have to expect. I always wear comfortable clothes. So like with me, when I went in that day, I had on some leggings, I had on like some little tennis shoes, something that I could just slide my little feet in, and I had on a button-up shirt. So therefore, while I'm putting my clothes on, I can put my clothes on and go with it. It was very, very easy. That morning, I had to arrive at like 4:30 that morning because I was first on his surgery. And to see all them people in there, they're just ready to be prepared. My surgery was at like 7 that morning. I had the anesthesiologist. Oh God, it was, I seen like 5 different people before my actual surgeon came in. Like he came in, hey, you ready? And I'm like, and then also too, guys, from me having the rosin in my back, they put me on this like metal. I never understood that. Like if somebody know what I'm talking about, comment below. It's this metal table that they put you on, but it's because you have hardware in your body. I never understood that, but I can just remember when I was getting ready, before they put me out, they was like, you have to lay directly on it. So I'm laying directly straight on it. Never knew what that was about. But had the surgery. Of course, you have to have someone there with you. My spouse was there with me. They basically just told him, get out, and we'll call you when it's done. Like it's a meal. We'll call you when it's done. Surgery went well. I think I might have been back home at like 11 o'clock. Now, this is the difference in between me and a lot of people. A lot of people, when they go home with drainage tubes. I did not go home with drainage tubes. He did not put any on me. He sealed me up with this seal that went all the way around. For the life of me, it about killed me. And then I had like my areola area was actually like taped all the way up. Even my like I said, my areola, that portion was taped up too, or whatever. And so I basically, you know, I could take a shower after 24 hours. I could, but I could not get my bandages and stuff wet. So did that. You know, I was able to, you know, wash myself with you know, the shower head or whatever. Like I said, my spouse, he bought me a brand new shower head or whatever, just so I could, you know, do things, be self-sufficient on my own. So like that, you know, that day, y'all, so greedy. Literally, I can remember, you know, my parents being in my house. I will never forget this, y'all. Do not try this after you have surgery. Y'all, I was so hungry. I can remember my stepfather and my spouse literally they went and got Philly steak and cheese. He had a chicken Philly. Y'all, I wanted a piece so bad. And mind you, they told me, you know, you got to eat something soft. So keep that in mind. Get you your soup, your crackers, your whatever, your Sprite, your ginger ale. Ginger ale is me. I don't care. That's my favorite drink in the world. I feel like nothing makes you better than ginger ale. I feel like it healed my body. But get that. Make sure that you stay on those things, because I promise you, you're going to need it. Literally, as soon as I took a bite of that Philly steak and cheese, y'all, I immediately threw up because it was too greasy for my stomach. And I still had, you know, all that medicine and stuff in me. And then also, too, you know, just with the opioid crisis or whatever, and, you know, in America or whatever, they don't give you opioids. So what they do is they put an opioid pack. It's like a medicine pack in your body that basically it releases medicine into you, and I guess it just dissolves. But you know, so literally I didn't have to have any medicines or anything like that or whatever. And I was grateful because I'm a person that, you know, I have scoliosis. I don't believe in medicine. When I go to my doctors, I don't run in there, hey, I need this, I need this, I need that. I don't do that. Like, I can literally take some Tylenol and I'll be fine. That's just me. I mean, I feel like in my life at one point in time, I will have to take those things, and I want to be transparent with my provider. Yes, I'm in pain now and I want to. I don't never ever take that for granted. Like I told y'all previously, I don't take for granted that when my back even hurts. Like, it's just not something I do. And I feel like people shouldn't do that, because it's really people out here who do need those medications. So anywho, literally ate that Philly steak, y'all. I threw that shit up. And I was in the bathroom doing it in silence, because literally my mom was like, you don't need to be eating it. Like, mad, Jericka, you don't need to be eating it. You don't need to be eating it. Y'all, who don't need to be eating it? Girl, I went in there and laid down, baby. So that night, and of course, my spouse here with me, whatever, he here, beck and call, whatnot. But y'all, I'm just so self-sufficient. Like, literally, I knew before I laid down, I had my medicine, the little pain medicines that they did give me. I think they gave me like Tramadol, Tylenol, and then they gave me like something else. They didn't give me antibiotics. That's another thing. They didn't give me antibiotics. That was kind of, I don't know. It was just different. I never, like, I'm so used to getting antibiotics like after the surgery. I don't know. But anyway, did that. And I remember when I got up in the middle of the night, I had to use the bathroom. So what I did, y'all, my work chair, because I work from home, my work chair, I literally rolled it by my bed so that I could pull myself up out of the bed every night. Like, literally, he even lowered my bed. Y'all, my bed used to be so high. He lowered my bed before I got, like, literally, I had a whole new room by the time I got home. Because literally, like, I literally was like, okay, I done everything. I'm good. I can go have my surgery. I got home. Homeboy done gave me a whole new bed. Lowered the bed, my brand new sheet. Like, homeboy did a whole 360 for your girl when I had surgery. Food. I came home and I'm still out of it, high. And I'm like, what's going on? So, but he just basically just wanted me to be comfortable. And I'm grateful for that. So grateful. But just having that surgery and even going back to like my post-op appointment, y'all, this is what gets crazy. So when I was talking about the drainage tubes, y'all, I could shake my breast and it sounded like water. Like literally like that's how it sounds. Sound like water. And so I was like, okay, I gotta go back to the doctor. I'm scared. I'm like, oh my God, they're gonna open me back up. I had one friend, she fell and she started leaking fluid. She had to go back and have a whole nother surgery on her breast. So I'm thinking about all these crazy things. I'm like, oh Lord, I don't want to deal with this. He should just put the drainage tubes in. He should have did what he was supposed to do. He did everything what he was supposed to do. Y'all, I can remember going and he had a physician assistant there that day because he was still in surgery. So she seen me or whatever. And she just like, okay, well, we can drain it. I'm like, okay. So y'all, I'm still numb. She shot me in the bottom of my breast, thinking I couldn't feel nothing. Baby, I almost kicked that lady in the next room. And I mean it. Like, I'm telling you, my breast was hurting so bad. It felt like she had cut me open and she just poked me. Like, she poked me. She was trying to poke me with a butterfly needle. No, ma'am. Literally, like, right after that, she told me, you need some compression. And so I remember my mom had gave me like, she gave me like this tight, like it looked like a girdle and it was like this tan color. And I was like, you know what? I do got a compression at home. Instead of me stopping at Target to go pick up one Walmart. Yeah, I went home and put that compression on. Yeah, I wore that damn compression every day. And I promise you, by the time I got done wearing that compression, that fluid went away within like 2 days. Like literally, I kept it on nonstop. Literally, take a bath, put it right back on. Take a bath, put it right back on. I don't even think I washed that damn compression. That's how bad it was. But after that, I'm not gonna lie. He asked me. He said, he was like, what do you want? He was like, how small you want to be? And I was like, you can make me an A cup if you want to. He was like, well, I can't do that. He said, well, I'll do you a full D. I said, okay. Y'all, by the time he got done and I finally healed, I started to lose weight. And once I started to lose weight, my breast was every bit of a C cup, which he told me that would happen. I tell everybody, when I talk about how small my breast is now, I say he did me grimy. But I actually have they're nice. Like, I wouldn't have traded this surgery for the world. Immediately relief off of my back, y'all. I was so used to carrying my breast, I would sit back now I'm just regular and I don't feel it. So like I said, y'all, if you do have any stories or you're in the process of getting a breast reduction and you have questions or anything like that, I will be happy to answer. Like happy to answer. So like I said, comment below, subscribe to my channel. I don't be doing nothing but daily blogs all day. I work from home. I ain't got nothing else to do. So, like I said, if y'all do have any questions or anything, just comment below, send me a message. I'd be happy to answer. But like I said, anybody, if this is something you really thinking about doing, just research, because I had a successful case, and you will have a successful case. We will never think anything negative. It will always be positive over here, regardless of whatever the outcome. Yes, it is people that do have bad cases, but in this case, A1. A1. I had that was one of the best surgeries I've ever had. Like I said, my provider had the best bed manners. Like, that's the best part about a surgery. A doctor that gives a damn about their patient, and he cared. Like, literally, he cared. Anytime that I had questions, I literally would go to the portal, I would send a message, and it wasn't an assistant or a physician assistant or a nurse practitioner getting back with me. It was my doctor. In spite of all the other patients that he had, he was direct with me. Whatever that I needed, anytime that I needed to see him for additional, like I had recently went because I wanted to consultate about getting a chin augmentation. Guess what? He was like, come on in, I got you. And by the good grace of God, he actually doesn't work for Vanderbilt University Medical Center anymore. He has his own practice. So I haven't been to him since then. So like I said, if this is something y'all are wanting to consider, go ahead. Get a breast reduction. If it's something that's bothering your back, if your insurance, most likely, a lot of people, if you have a severity case like me and it's medically necessary, mine was medically necessary. My insurance paid for it. Yes, I did pay out for a lift. And at the time, like I said, I was able to pay for that lift for them to be lifted how I want to, and they were. So like I said, if you have any questions, just contact me or send me a message or comment below, and I'm gonna comment back, baby. So y'all have a good day, and thank you for watching. Subscribe and like.